Even as Border Patrol agents make record-breaking seizures of fentanyl, there has been a surge in overdose deaths this year, as the synthetic opioid pills, known on the streets as blues, continue to have a strong grip on communities locally. Alarming new data shows how it's driving overdose deaths in King County. So far this year, the Public Health Seattle and King County dashboard shows 198 people have died from a fentanyl overdose. That's up significantly from 2022, when there were 113 fentanyl overdose deaths in King County during the same time period. As fentanyl fatalities surge, local governments are putting more emphasis on harm reduction strategies. Some efforts, like legalizing fentanyl test strips, are not without debate. But David Dickinson, the regional director for the Substance Abuse and Mental Health Services Administration, or SAMHSA, says the goal is to keep drug users alive so they can have a chance to recover when they're ready.
I have sat with families who've lost a loved one.
David Dickinson is a behavioral health expert who firmly believes that harm reduction is the right strategy to beat the fentanyl crisis. These fake opioid pills are flooding into our state, more powerful, dangerous, and addictive than ever, all to lure in those already vulnerable to abusing them.
When you've lost your job, you've been disconnected from your family, you've lost family members, all of those can contribute to sort of unbearable emotional pain. And so people turn to substances, sometimes legal substances like alcohol, or sometimes illicit substances like heroin or fentanyl to relieve that pain.
That means meeting drug users on their turf to stop overdoses without judgment.
But what we do know is if you're dead, you can't make a choice not to use. When we talk about the opioid epidemic, means taking the necessary steps to make available to people opportunities to reduce the likelihood of death. That's a harm reduction. A life saved means a life with another chance, another opportunity.
SAMHSA recently gave Washington $27.5 million for state opioid response funding to support and expand treatment services, plus block grant funding for another $39 million, money that could be spent on fentanyl test strips. Right now, those are considered illegal drug paraphernalia in Washington state. However, a bill is making its way through the legislature that would legalize them.
If you have fentanyl strips available in the community, let's say someone goes to a needle exchange site, but they could also acquire fentanyl test strips. If they're actively using and they test the substance before they use it, there's a chance that they don't use that particular substance. So right there, you may have saved one life.
Dickinson says another step in the right direction is a recent change by Congress that allows drug users to get opioid use disorder medication like buprenorphine directly from their primary care provider.
And if you have a trusted relationship with your primary care doctor, then you have this opportunity to have an open conversation. So we hope that that'll make a big difference because we'll have more prescribers available to prescribe buprenorphine and to alleviate people suffering from the disease.
Still, he estimates there are more than 9 million people abusing opioids in the U.S. Even though only about 1 in 10 of those will actually seek treatment, there still are not enough beds and services available. So last fall, the Biden-Harris administration awarded $1.6 billion in funds for communities to start to address the overdose crisis.
I have to be hopeful that we'll turn a corner on this, and that rather than focusing on the deaths that have occurred, as sad and sorrowful as those are, that we will begin to focus on the lives that have been saved.
Dickinson says Washington state has an impressive model that tracks the number and locations of treatment beds available in your area. If you or a loved one is struggling with addiction and you're looking to find treatment, you can call the SAMHSA National Hotline. The number is 1-800-662-HELP, or go to www.findtreatment.gov.